Hello, I'm Dr. Amanda Stewart. I'm an endocrinologist at BMI Woodlands Hospital in Darlington. Thanks for joining me on World Diabetes Day. In this short video, we'll look at the 3 key messages for this year's campaign. The first is discover diabetes. I'm sure most of you already know that uncontrolled blood sugar is a central feature of diabetes. There are 2 main kinds as well, type 1 and type 2. Type 2 is much more common. In the UK, there are thought to be around 4 million people with diabetes. 1 million of these may not yet be diagnosed, and another million is projected to be diagnosed in the next 10 years. Up to half of the cases of type 2 diabetes are actually preventable. So that takes us to message number 2, which is preventing type 2 diabetes. Well, the mainstay is healthy lifestyle choices. So maintaining a healthy weight, or if you're already overweight, trying to lose some weight, making healthy diet choices, and limiting quantities of the food that you eat. In general, less fat, starch and sugar, and more vegetables are healthy. But remember that even healthy foods such as brown bread will increase your weight if you eat too much of it. Everybody has different needs according to their lifestyles already and how much weight they need to lose, so please take professional advice about what's right for you. On the other side of healthy lifestyle choices, we have activity. It's very important that we're active, but unfortunately when people say exercise, that quite often makes them feel anxious. But you don't need to go to the gym and you don't need to run a marathon. You just need to get moving. It could be taking your dog for a long walk. It could be putting music on and dancing around your living room. It could be playing with your children or grandchildren. If you have difficulty moving because you've got leg or hip problems, back problems, or any other disease that makes it difficult for you to exercise, find some activities you can do with your arms. It could be just throwing a ball, bouncing a ball, or even lifting a bag of sugar while you sit in your chair. Any activity is good. It's recommended that you do 150 minutes of activity a week, which works out as about half an hour a day for 5 days a week. Activity, even if it doesn't help you lose weight, will help your body control your blood sugar better and will take the strain off the vital organs that are required to do this. Key message number 3 is for those people who already have diabetes, and that's about management of diabetes. That means your treatment, your healthy lifestyle choices, and your follow-up. Having treated people with diabetes for the last 20 years, I'm very passionate that individual patients should have treatment that suits them. We're so lucky that in the last few years we've seen lots of new medications come onto the market. If you're not happy with your medication, if you're getting side effects, if you don't feel well with it, or you're worried that your control's not as good as it should be, then go along and talk to your doctor. I'm sure you'll find something that suits you. Our final note is about your follow-up. It's very important that you see your doctor regularly for checkups. Your blood pressure and cholesterol need to be under control. That's good for your heart health in the long term. And also you need to check for complications of diabetes. The reason for this is if you catch them early, they can be treated properly and hopefully won't cause any problems in the long term. If you leave it too late, they can be very problematic. So thank you for joining me. If you need further information, please visit Diabetes UK's website. It's www.diabetes.org.uk, or just put World Diabetes Day into your internet browser and you'll get lots of information. Wishing you good health.